Good afternoon and welcome back to Facebook Live here on the Oneida Reservation. It's Friday, July 10th, and we're here today with our Division of Comprehensive Health Director, Debbie Danforth, our Chairman, Dehasi Hill, and our Vice Chairman, Brandon Stevens. Today we're going to talk more extensively about the recent extension of the public health emergency. And as always, I know some of you get tired of hearing this every week, but we sanitize our surroundings, we mask ourselves, we make sure that we're socially distanced, we're prepared to keep ourselves safe as well as keep one another safe during our segment. We just want to be clear today that the order that was extended is something that we've had in effect since March 12th. So please keep your comments and your solutions and your questions relevant to the issues that we're discussing today. And with that, we're going to go right into our health update with Debbie.
Thank you, Bobby. Good afternoon, everyone. I'm going to first start out with just an overview of the numbers. And I want to give you a little bit of a picture about what we're talking about. So globally, a month ago, we were at 7,258,842 positive cases. Today, we're at 12,292,678 positive cases with 555,493 deaths globally. Within the United States, about a month ago, we were at 1.9 million positive cases. And today, we are at 3,118,168 positive cases and 133,291 deaths. Within the Indian Health Service, we are at 23,074 positive cases as of today. The Albuquerque area is at 1,220 cases. The Bemidji area, which is where we are located within Minnesota, Wisconsin, and Michigan, we are at 406 cases. The Navajo area is at 8,981 positive cases. And Phoenix is the next highest area at 5,929. For the state of Wisconsin, as of today, we're at 33,908 with 809 deaths. Brown County alone is 3,123 with 43 deaths. Outagamie County is at 597 with 9 deaths. For Oneida specific, within the reservation boundaries, we have a total of 51 cases, which is an increase of 1 as of this week. Oneida Nation Brown County, we have 22 cases. And Outagamie County, for the Oneida Reservation, we have 29 cases. And unfortunately, we have 2 deaths within Outagamie County attributed to COVID, and 1 case which remains in isolation at this point. So we are doing very well in terms of our numbers. However, we continue to see an uptick in all of the numbers across the board, which is one of the things that we want to continue to emphasize to the Oneida community. Our first Oneida jurisdiction case occurred on April 1st, 2020, and since that time, we are currently at 51 positive cases. We remain very consistent in our message to the Oneida community, and we want to thank everyone for your hard work and your diligence in continuing to mask, continuing to practice social distancing, continuing to sanitize, washing hands, avoiding large gatherings. And again, we want to really emphasize, if you must go out for the safety of yourself, the safety of your family members, please, please make sure that you have a cloth face covering of some kind, whether it's a mask or some kind of face covering, because that alone is going to help to protect you from the virus itself. One of the things that I wanted to talk a little bit about today is that we were asked to share what some of the measures have been implemented within the health center as far as closures and how we are recovering from that. So since the onset of the health center and the areas within the health division, we have continued to remain open, although we have changed the process in terms of how we provide those services. Due to the pandemic, we've had to change the way that we've had to provide those services. Within behavioral health, for example, we've gone pretty much virtual in terms of no face-to-face visits, but most of those visits have been gone to a virtual setting. Patients and clients are contacted by their provider, and a determination on how often they'll be followed by their provider and whether it'll be via a Teams application or simply over the phone is the process that we follow, both within behavioral health and within the medical clinic. Within the medical area alone, we do a combination of virtual visits, face-to-face visits within the clinic, and that's based upon the need of the individual patient. Many of our patients have verbalized that they really enjoy and really like the virtual visits, particularly over at behavioral health. They feel much more comfortable with a virtual visit versus the face-to-face. For dental services, we still are restricted to emergency visits only, but we're hoping that that will change soon as we move forward. Unfortunately, we don't have a date at this time, but we have submitted a request for a recall of some of that staff within the dental department to begin to enable us to see more patients. However, because of the fact that the dental visits are aerosol generating, which means the droplets that come out of your mouth during breathing or during procedures, we have to take additional precautions between patients for the safety of our patients and our staff to ensure that everyone remains safe. For optical, we have been seeing urgent visits, and we hope to increase the number of patients that we can see, but this again is dependent upon our ability to assure social distancing, not only for our patients, but also for our staff. Pharmacy continues to be open daily, Monday through Friday, 8 to 5 p.m. And we do our best to assure that patients visiting the pharmacy are social distancing, and at times, due to the number of people coming in daily, we may have to ask you to wait outside. We may have to ask you to come back until we can assure that you're safe and that we can provide that necessary social distancing. And we apologize for that inconvenience, but this is for your own safety. In addition, we've added some home delivery of medications for our elders in the community and within reservation boundaries. So if you do have a compromised medical condition that would make it difficult for you to come in or increase your risk to being exposed within the clinic lobby, please contact our services within community health nursing. The health center closures that remain and forecast for the recovery, at this point, it's really hard for us to identify when things are going to go back to normal, or is this the normal that we will go back to. With the recent increase in the positive tests, whether this is going to be a second wave or not, there is a second wave predicted. It's hard to say what's going to actually happen. We know that at this point, this is still part of the first wave of testing that we're seeing and the positive results. And we're moving forward with planning to recall the first phase of staff within the division, but the biggest area of concern is our ability to safely social distance within the facility to keep our staff safe and our patients safe. It may mean that we have to extend some of our hours to allow for more patients to be seen, but less people within the clinic lobby waiting to be seen. I know one question that has come up from the community is, we have all the empty chairs, why can't we go in the health center and sit and wait for pharmacy? Again, our point is we want to make sure that you are able to socially distance while waiting for pharmacy services. The critical point that we want to emphasize is that we want to assure that everyone is safe. When we talk about what new normal is, we definitely know that there is a new normal and things are going to be different. I think we'll continue to see a combination of face-to-face visits throughout the health division, virtual visits as we move forward. We've had a lot of patients that, as I said, tell us that they like the virtual visits. We will eventually get back to increasing the number of patient visits as we move forward, but I think you will continue to see the screenings of the temperatures at the door, the face masks, and social distancing for some time into the future. The nursing home closure has been another common question that comes up. And what is the forecast for recovery for the nursing home? What is the forecast for new normal? And again, we know it's been hard on our residents. We know it's been hard on families not to be able to see their loved ones face to face, not to be able to give everybody hugs. And we thank you for your patience during this time. We closed the nursing home doors on March 12th, 2020. That's 121 days. At this point, we can't provide you even an estimate of when we can begin to open the doors for visitors to the nursing home. and our main concern is the safety of our elders and our residents. We began testing all staff on a bi-monthly basis for our continued safety of our residents, and we began testing everyone so that if we do get a positive test, we will know specifically when that occurred so that we can help to reduce the risks to our residents and to our community. As far as our numbers within the health division, we currently have 284 employees within the health division. 84 are on layoff or furlough, including some contracted staff. I was also asked to talk a little bit about what the CARES funds are being used for. Currently, the CARES funds are being used specifically for the purchase of anything that's COVID related in accordance with the law. That means that the purchase of laptops and webcams, headsets, so that visits can be conducted virtually for staff have been some of those things that we have utilized those funds for to allow our staff to telecommute due to COVID. Any kinds of personal protective equipment such as N95 respirator masks, face masks, shields, gowns, and specific day-to-day supplies needed for the protection of staff and patients for the prevention of COVID spread are what we have utilized those CARES funds for. Testing materials to perform the tests, test kits, and drive-through testing supplies, etc. are all of these items that we have utilized CARES funds to purchase. And that includes not just for the health division, the health center, but also includes the Anna John Resident Center care community. What's not funded basically are any day-to-day supplies that we would routinely use for the provision of day-to-day operations that normally our Indian Health Service funds would cover. So that's what we specifically use, services that are not COVID related. So overall, the forecast for the health center, for the health division, and for the Anna John, I think what you see here today is the new normal, because as we move forward, we are going to continue to see face masks. We're going to continue to hear us tell you on a day-to-day basis to make sure that you're wearing your masks, make sure that you're sanitizing, make sure that you're social distancing, avoiding large crowds. If you do have to go out to the grocery store, make sure that you have a mask. When I've been out to the grocery store, I know that I've been the minority in many situations because people just are not masking, but we want to assure that our community continues to stay safe, and that's why you continually hear us tell you practice social distancing and wear your facial coverings. So that, I think, is our new normal as we move forward. We're in a very different world today, and I want to encourage everyone to take the time to be nice to each other and to ourselves. I know it's been stressful, I know it's been difficult, but I just want to close with a saying that it's one thing to know that you're running a marathon. It's very different to pace yourself when you have no idea when you'll be able to stop running. And right now, we're all continuing to run. So thank you. With that, I'll turn it over to Chairman Hill.
All right, thank you, Debbie. Suguli Sogway. I'd just like to take a moment to commend our community, as Debbie just reported out, of our numbers of positive cases in our community continues to remain low. And so I think that's a good testament to our communities heeding the advice that Debbie just shared about social distancing and sanitization. And so with that being said, I'll move on to, I guess, the next topic I wanted to cover, which is the extension of the Safer at Home order. On Wednesday, the United Business Committee took action to extend the Safer at Home order for an additional 30 days. So what that basically means is all the precautions that we've outlaid in every one of these Facebook Lives and any other communications that we can put out there, are still in place, and that the Oneida Gaming Casino will remain open. They have a safety plan, approved safety plan in place to try to mitigate the risks in our facilities for both our employees and our patrons. And as different areas look to programs and services look to potentially open up, they also have submitted their safety plans for approval as we continue to go forward. But I just want to make sure everyone understands, as we have extended the public health emergency, and even if it were to expire sometime soon, that still does not mean that we were going to be able to recall all of our employees that are on furlough or laid off. You know, that is an important aspect, I think, that we continue to monitor and try to make as clear as possible. You know, it's not that we don't want, you know, to bring our employees back. It's simply that we cannot afford to bring our employees back. So we got two tracks going on here. One, the COVID response that we've taken to assure public safety. Then the other aspect of it is the financial aspect of it, where our gaming facilities are open and have just opened up this week phase 2, which allowed some table games and bingo to open this week with safety procedures in place. But that still doesn't mean that we're operating fully with the expected revenue that was projected to be brought in during this time. And so that is really what is constraining us from really moving forward more quickly. So we want to make sure that we're taking the proper steps, you know, every day, every week, and planning properly, or taking those steps forward to bringing us back into a state where we're able to afford to provide the services that we normally provide. But at this point, we simply cannot afford to do so. And so I just want to make sure, you know, we're abundantly clear that, you know, even though we extended the public health safety state of emergency for an additional 30 days, and looking forward into even this fall and this winter, this doesn't seem to be going away quickly. And as Debbie had mentioned in her last quote, you know, we're all running here, but we don't know how far we got to run in this particular situation. It could be, if everyone heeds the advice of the health professionals and wears masks and social distances and takes proper precautions, we can get through this quicker. But with the current state of, I guess, outside public's willingness to follow precautions and the continued spike, I guess, in this first wave, it is difficult to estimate when we will be able to lift this public health emergency. So I just want to make sure that we're very clear that this isn't looking to be ended anytime soon. I think even as we continue through our election processes here at the end of this month, the next committee coming in, whoever shall get elected, is going to have to also weigh these facts out and continue to make decisions, hopefully the best decisions possible for our community to be safe in this current environment. And so I just like to say about that much on the extension of the public health emergency, what that means for our nation and for our gaming facilities and our retail, and some of the social services programs that we are currently operating. That, you know, it's really right now is about all that we can afford to do is what we are doing now. And so I would just like to thank you for tuning in today, and I will turn it over to Vice Chairman Brandon Stevens. Go.
Saguli Swagway, I'd like to thank everyone for joining. I'm going to go over just kind of the information that we've sent out and what we're going to send out. We have it's the COVID-19 update number 2. It'll look like this. If you go onto the members only website, it's on there right now, and a hard copy will be in the mail early next week, and so you'll be able to see it tangibly in your hands. But the second update, the first update was sent out in April, and it went through all the immediate impacts that we had at the time and how we're dealing with them. And the update number 2 will go over the same timeline, the overview of what had happened, milestones and major events and the dates that we made major decisions. But also, more importantly, a lot of questions are becoming more so about the CARES Act funding and all the outside funding sources that have been coming into the United Nations. and it addresses where they've come from, how they can be used, the criteria and guidance from which the Treasury has delivered. And on the outset of that, we're developing on how to format an information piece to show the community how we're spending those funds. And so that's a very, very detailed, a lot of numbers, but then we understand that the community wants, needs, and should see the information like that, consistent with federal funding coming to the tribe and how we're spending it. So that will be out early next week. Like I said, it's on the tribal members only website right now. And another emerging question that we've been also looking at nationally is how other tribes have been distributing CARES Act funding under the guidance. Some tribes have done it immediately and I would say not necessarily under the guidance of the Treasury that was submitted by Treasury. And so what we've been doing is carefully constructing what is called the COVID Pandemic Relief Assistance Program, which provides the criteria and assistance to tribal members that would make it legal under the guidance from the Treasury. So I'll go over, the CARES Act provides that payments from the fund may only be used to cover costs that, 1, are necessary expenditures incurred due to the public health emergency with respect to the coronavirus disease, COVID-19. 2, that were not accounted for in the budget most recent approved as of March 27th, 2020, which was the date of the CARES Act enacting. And 3, were incurred during the period that begins on March 1st, 2020 and ends December 30th, 2020. So those are the basic criteria that the CARES Fund has to align with. And so we developed a program that will address all those issues for families that have been impacted by the COVID pandemic. Situations like mortgage, rental assistance, utility assistance, including electric, gas, water, etc., telecommunications and technology, examples would be Wi-Fi access, and perhaps laptops, medical bills, food relief, job seeking, training assistance, like transportation and childcare. So the beginning of this program is set tentatively for August 1st, so we're trying to find out the how-to do it safe, to keep our employees safe and be able to administer, whether we can do it online like other tribes with the capacity would be, but also how to get it out as fast as we can, because we know there's dire need of assistance through the pandemic in this period when a lot of individuals have been unemployed. So I just wanted to give that a little update on what we're working on as far as development of releasing COVID funds for individual assistance. So we had to go through a lot of questions in answering, making sure that we address issues of taxation, income-based programs like SSI, SSDI, Medicaid, that we know and understand the impacts of getting that relief aid would have on the individual. So I know the questions will come in, but all this information will be forthcoming as soon as we develop the program further, and we'll send those information pieces out to the community when that is finished. Thank you.
Thank you, Chairman, Vice Chairman, and Debbie. Going to some of the questions that we've been collecting is for Debbie. Do you know what cases are tying back to? So when somebody is identified as to having something, having the COVID, where they're tying that back to? Is it a common place? And do you think the contact tracing is working?
Basically, when a case comes to our attention, it is our responsibility of the public health nurses within the reservation boundaries to do that contact tracing. And the information that they gather is based upon the information that each individual shares. So that's why we have emphasized time and time again to please make sure that you share the information when they're answering the questions about where they might have been, where they have gone to, so that we can do that contact tracing and make sure we contact any individuals that we think may be at high risk of exposure because of those cases.
Thank you, Debbie. Another question for you, Debbie, is there are non-tribal dental offices open all over the place. Why are they opening and we're not opening?
As far as what we know, the non-tribal dental offices that have been opened have also had the same types of precautions that we have. They are still limiting as far as the number of patients that they're seeing, and it all is based upon the safety in terms of what personal protective equipment they have access to, what they can do in terms of providing each patient, and again, it goes back to staffing.
Okay, thank you, Debbie. Another question, Debbie. Can you tell us how many tests, or even an estimate of how many tests have been conducted, and whether or not you have a breakdown of how many are testing employees and how many are testing community members?
We don't keep track in terms of the employee base other than those that are specific to healthcare, but I can tell you, let me just check my notes real quick. The last time, which was on the 7th, I don't have updated numbers since then, but the last time that we did keep our counts for July 7th, we had completed a total of 963 tests within the health center, within the drive-through. Out of the 963 tests, 43 of those were positive, which is a positive rate of about 4.47%. But we do not specifically keep track of which employees are coming through the facility. The only thing that we keep track of is the number of healthcare workers, because we report that to the Bemidji Area for Indian Health Service.
Okay, thank you. This question is for either Brandon or Dehasi. I don't know if we have the answer at this level, but are there any updates on the SOPs for hazard pay for the critical frontline workers for the nation?
I know we were just talking about the SOP. There is one in place, and I believe it is up to the managers and supervisors of the areas to take that count. And I believe they're formulating with the employee base, I guess the amount of hours and the type of risks that they were, the employees were potentially working in as a part of that SOP. So it is, as far as I understand, it is in progress of being implemented.
All right, another question for you, Chairman Hill. Have our gaming compacts costs been waived or relieved during this pandemic?
So that was a request that the nation has made to the governor very early on in this process. And at this point, there isn't a definite answer as to being waived, but they are definitely being told, I guess, at this point, where they're being set aside to be worked out later. So normally our compact payment would have been due, I think it's the end of June. We have not had to make that payment at this point, but we haven't got a solid answer from the state as to if they're willing to forgive that payment or have it come due at a later date in a different fiscal year.
Okay, thank you. I know that Vice Chairman Stevens, I know you just spoke a little bit about that individual stimulus payments that some of the tribes are exercising, I guess, in dispersing their payments. Question we're getting is that specifically the Ho-Chunk is sending out payments to their members, and other tribes in Wisconsin have been sending out payments to their members. Perhaps you can speak about the difference in how those tribes might be implementing this change, as well as their numbers. And I do know Ho-Chunk made a payment, but they also released a large portion of their workforce.
Yeah, guess the nuances of how other tribes are doing different things is more along the lines as capacity as well as risk tolerance. And so that if they're willing to risk going against the guidance that Treasury has provided, they're understanding that there's a risk involved. And so the Inspector General at the end of this period, December 30th, there's going to be a report that's going to be submitted to Congress. And the Inspector General has about $28 million to audit, to go into the expenditures of tribes and how it was done. And our careful methodology is making sure we don't want to be one of those models of how not to do it and have any repercussions at the end of the day. And the Treasury has been very non-specific about how they're going to deal with those tribes that went outside of the guidance. And so I'm going to read directly from the Treasury Department guidance and specifically addresses your question. One of the facts, the frequently asked questions on here in the Treasury Department and how they answered it. Must a state, local, or tribal government require applications to be submitted by a business or individuals before providing assistance using payments from the fund? Now that's the question. This is how Treasury answered it. Governments have discretion to determine how to tailor assistance programs they establish in response to the COVID-19 public health emergency. However, such a program could be structured in a manner as will ensure that such assistance is determined to be necessary in response to the COVID-19 public health emergency and otherwise satisfies the requirement of the CARES Act and other applicable laws. For example, a per capita payment to residents of a particular jurisdiction without an assessment of an individual need would not be an appropriate use of the payment from the fund. So that's specifically a question that has been addressed, just a broad, overarching, everyone gets a payment, is not fall within the legal language of the CARES Act. And so that's why we're very careful on how we distribute any funds would have to be based on need.
So is that a part of the assessment that the tribe is doing now to find out what the need might be or how they may be able to address individual stimulus payments based on an assessment of needs?
Yes, and what some tribes have done, they asked individuals to submit like an affidavit and sign to say that we're going to be using this fund for specific COVID-related impacts. And what we're requiring is pretty much the same thing, is that they sign a document that lets us know, first of all, their impacts, sign affidavit identifying COVID impacts to individual family. So we're just requiring them to tell us how they were impacted. And so that could be everyone, but they would just have to prove that they have been impacted by the pandemic. And we just can't blanketly send it out.
And I'm going to kind of combine, there's a couple of sentiments here about individuals who do not live on the reservation. Enrolled Oneidas, what type of benefits or resources can we direct them to if they don't live on the reservation?
For the program we're developing, it's going to be for everyone not even off reservation as well. So that will be a non-location specific.
So if I live in Colorado or East Green Bay and I can justify the need or request that, then I would be eligible for those individuals.
Correct.
Once you have the plan in place.
Yes.
Okay. Never heard of other 18-year-olds not receiving their money. My granddaughter was told no funds to them back in December. My understanding was this money is accumulating, so what happened to the money? The 18-year-old trust fund is still in a trust fund. That money was not touched, it did not go away. So 18-year-olds who meet the qualifications for payment by having their high school diploma and filing their paperwork, they are going to get their payments. This is not COVID related, that payment. So if they are not getting their payments It's an oversight, perhaps they didn't send something back, they don't have an updated address, they didn't provide the deposit information. Call enrollments at 800 571 8872. 8802, I'm sorry, for enrollments. Look them up on our website. So those monies are totally separate from the tribal budget, and that should be paid out. I think and this is, I don't think, something that we can answer today, but there's always a lot of questions about who got called back, why they got called back, whether they're enrolled or not enrolled. But a statement was, the solution is that maybe the standards, maybe advising you all of what standards are used for callback might be helpful to help understand that. And in a future segment, we'll work on getting more information from HRD. HRD always has a lot of questions, and we can't answer for HRD right now. The gaming compact comment, we did answer that. As I said, we do have the treasurer and finance advising them of the questions that are coming into us every week. We hope to have the treasurer and finance again very soon on an upcoming segment. There's a lot of questions about those CARES monies, about how they're planning to use those. We'll continue to keep you informed. And I don't know the answer to this question. Has energy assistance been eliminated and separate from economic support? I don't know, sorry. But in the comment section, we're looking for those answers, and those that we don't get on the air, we'll try to follow up and get those answered. In closing today, we know that a lot of people want to know about those COVID funds, and it's, you know, at the top of your head, sometimes it's difficult to recall the numbers, to even know what all these different budgets look like. But to put something in perspective, the plexiglass, the price of plexiglass is sky high. Gaming spent nearly $500,000 on plexiglass alone. They also had to get additional supplies and sanitary. So it's not just masks. It's restructuring our community. It's restructuring within our offices. It's making sure that we have the handheld temperatures, that we have protection, that we are able to isolate individuals. So it's not just all masks. It's a lot of the structural changes. It's a lot of equipment purchases so that people can do the virtual meetings, that our doctors can conduct a virtual health assessment when it's necessary, when they can do it. So a lot of these equipment, it's challenging to put things in a line item for you and say, here's where we spent money, this is what we did today, this is what we did yesterday. It's an ongoing process. Every day there are more needs coming in. Every day we're discovering there are new ways to isolate, to distance ourselves, to do things, and the equipment that's available. So those are some of the things that it's an ongoing, we work on it every day. Trying to get a consolidated cost of expenditures is very difficult, but we continue to try. On another note, the Oneida One Stop is suffering from a coin shortage, and that's sort of a nationwide problem. So they ask us to say whenever you have the correct change, they appreciate it. They're looking for coins. And we're thankful to see some of the other governments in our community are kind of falling in line with what Oneida is doing. Outagamie County and Appleton, in the news today, we heard that they are going to require masking in their facilities and in their public buildings under the city and under the county. So now they're beginning to get it, and now you're beginning to see why we have to extend our order, why we encourage people to stay safer at home. We know you need to go out. We know you go grocery shopping. You need to go pay bills. You need doctor's appointments. You need to go to the store every now and then. But do that with precaution. Do that with your mask. Sanitize when you're done. Keep that safer at home habit. all year round. Just continue to do that. We're not going to be closing anything back down. It's a matter of staying safe, and Oneida has done a great job at being a little safer. With our heat, we've had a lot of hot days. Please remember to check on your elders and our most vulnerable people in our community. Offer to take them for a ride maybe to the mall if you have an air-conditioned car. Put your mask on, sanitize, maybe get them out. I'm sure they're just as tired of being at home and watching the same Netflix shows as the rest of us are. We also want to say that it's been a very difficult time, and to say your prayers. It's been the most difficult time we've ever had in our history for families who are experiencing funerals. We're used to going to that family and putting our arms around them and consoling them and contributing and being to their fire, coming to the funeral, going to the wake, being there for our families and our loved ones and our friends. And at this time, the COVID prevents most of us from doing that. So it's a very difficult time, as well as celebrations, birthdays, anniversaries, weddings, graduations. It's very difficult, but we continue to encourage you to stay with our safer at home as much as possible. We realize sometimes it's not always possible. And as a mother, I know how hard it is to not be able to reach out to your children, and parents, grandparents, seeing the little babies, newborns. But we just have to remember to do it as safely as we can and encourage people around us to respect our safer at home order and our distancing. And with that, we just want to say, remember our core values. We nurture the fire within ourselves. We encourage the fire in all others. We work to encourage a good mind, a good heart, and a strong fire. So continue to keep your prayers going for a safe and healthy community. Skana.